we are releasing this agenda today and seeking support for it because even though our governor and legislature worked very hard together during the last legislative session to pass several important bills aimed at addressing the crisis we're experiencing, the work is not done. New Hampshire remains in the grip of a relentless opioid epidemic. Last year, overdoses killed 439 of our fellow Granite Staters. It is projected that overdoses will kill almost 500 of our neighbors, friends, and loved ones in 2016. So although progress was made during the last legislative session, New Hampshire citizens and policymakers must not be lulled into a sense of complacency that our crisis has been solved. It took years of policy neglect to get us into this situation, and it's going to take years of policy support and implementation to get us out of it. The 5 initiatives in our agenda are intended to build on the progress that has been made so far. Those initiatives are restoring the alcohol fund, supporting permanent Medicaid expansion, investing in statewide evidence-informed prevention programs, advancing behavioral health workforce development, and removing barriers to insurance coverage for substance use disorder services. Each of these initiatives is a critical part of a core, comprehensive policy approach to reducing substance misuse in our state. So the people standing behind me today are here to show their support for this agenda. New Futures and its partners, including hundreds of trained advocates and recovery coaches who are committed to bringing an end to this crisis, will be asking community members, civic leaders, elected officials, and candidates for office to support and endorse the agenda. We look forward to working with everyone willing to join with us in turning the tide on our state's most pressing public health crisis. So with that, I would like to introduce the first of our speakers to talk about the importance of each of the 5 initiatives in our agenda, and that is Tim Rourke, Chair of the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery, and he will speak to the importance of a fully funded alcohol fund.
Thank you, everyone. It's a pleasure to be here this morning. Again, my name is Tim Rourke. I'm chair of the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery. The commission was established in 2000 with really 3 purposes. We advise the governor and the legislature on policy and fiscal matters related to substance use disorders. We are charged with the creation and implementation of a state plan to address substance use in the state of New Hampshire. And we manage something called the Alcohol Fund, which is what I will talk a little bit more deeply about in a moment. I first want to echo Linda's thanks to the governor, the legislature, and all of the community advocates, family members affected, providers, men and women in recovery who have raised their voices over the last several years to bring a light to this epidemic, to talk about solutions, and to begin to move forward on strategies that we know work to help people manage what is an entirely preventable, treatable, and recoverable illness. The Governor's Commission has a state plan that was created in 2013, Collective Action, Collective Impact, and because of the bipartisan support, the groundswell of visibility on this issue in the community, we have been able to implement much of that plan, in part because we as a state have something called the Alcohol Fund. We are a control state. What that means is that unlike other states, hard liquor is controlled and sold by state government through our system of state liquor stores. There are a number of reasons why being a control state is a good thing, particularly from a prevention standpoint, where our Liquor Commission ensures that products are brought to market in New Hampshire that are not targeted at children. But alcohol consumption and the overconsumption of alcohol costs the state of New Hampshire $1.2 billion a year. When you add all other drugs, lost worker productivity, law enforcement costs, related healthcare costs. That total cost to our state balloons to almost 2 billion rather, thank you. That's why Linda's here. But the vast majority of that 2 billion, 1.2 billion, is because of alcohol. So in 2000, the legislature thought that perhaps, given the cost of alcohol to our state, both economically and socially, we should be taking a percentage of those profits and dedicating them to relieving those consequences. And that was the establishment of the Alcohol Fund. When it was established, the idea was that the fund would contain 5% of gross profits that would go into a fund to support prevention, treatment, and recovery support services. What have we done with the funds that we have been given? We have continued to expand access to treatment. In the past 2 years, we have seen an increase in treatment capacity in our state. More individuals arrived in treatment earlier this year than had historically, so we know that more people are getting help. We are beginning to see the growth of community-based recovery support programs, recovery centers, recovery coaching, training for people with lived experience to be there at the point of need to help people enter into recovery and stay in it long term. We have begun to make modest investments in prevention, recognizing that this is a preventable illness. Recently, we put in expanded resources for medication-assisted therapy to make sure that those with an opiate addiction have access to the best treatment science has available. However, to Linda's point, it is not enough. And it is not enough because when the Alcohol Fund was passed, as I said, its allocation was 5% of gross profits. That was funded once, in 2000. In subsequent years, the formula was suspended, which means that for those subsequent years, the Alcohol Fund was empty. Let me say that again. The Alcohol Fund was established in 2000, and until this current biennium, it was empty. Instead, what was done was the legislature would, or the governor, depending on the year, would zero out that formula, making the fund empty, and then establish a general fund appropriation for the governor's commission to manage within the budget of Health and Human Services. That amount never equaled the 5%, and it still doesn't. In the last budget debate for the current biennium, the legislature, with the thanks of the bipartisan leadership in the Senate, did return to following the formula of the Alcohol Fund. However, they reduced it from 5% to 1.7%. And while we did receive an additional $2.5 million in the special session, in the legislative session that just concluded, that we are deploying as we speak, it still does not get us to the comprehensive system of prevention, treatment, and recovery supports we need. This year, the state of New Hampshire made $671 million on the sale of alcohol. And while we are railing against an unbelievable opiate epidemic, and while we are looking at the next epidemic to come, perhaps methamphetamines, we need to remember that alcohol kills more people than all illicit drugs of abuse combined. With a $671 million profit, I am relatively confident that a 5% allocation would be an adequate symbol that we believe that in a socially responsible business model, we should be taking some of those profits and being part of the solution as opposed to singularly contributing to the alcohol problem of our state. The Commission looks forward to working with New Futures and their partners in endorsement of the entire 5-point plan, because a fully funded alcohol fund will not be enough. A comprehensive, challenging, complex problem requires comprehensive solutions. This 5-point plan gets us there. But we look forward to working with the advocates, with New Futures and their partners, with officials running for office on every level, to talk to them about the importance of this alcohol fund, to talk to them about the Commission's work in this arena, the outcomes we are achieving, and the outcomes we know we can achieve if we are given the adequate resources to do so. So my thanks to New Futures, all of their partners for coming up with this 5-point agenda. The Commission looks forward to working with them this coming year. Thank you very much.
Thank you, Tim. And now I'd like to introduce Ashley Hurdo. Ashley is a Medicaid expansion enrollee, and she's going to share with you all her very compelling story and how important Medicaid expansion has been to her and in her life.
My name is Ashley, and I'm here today speaking to you for one major reason: the access to health insurance I have through Medicaid expansion. Like thousands of Granite Staters, I suffer with substance use disorder, and I am sad to say, because of it, I've been incarcerated more than once. Before I was incarcerated the second time, my husband and father to our child overdosed and died. After his death, I found myself in a state of despair, and I ended up getting arrested in Hudson again. The officer who arrested me showed me the most compassion I had felt in years. He asked me questions and prompted me to actually think about my future and the future of my son. After I was released from jail the second time, I was able to enter drug court, but only after I received health insurance through Medicaid expansion. I want to make this very clear. The only reason I'm in drug court, employed, pursuing my CRSW, and I'm able to be a clear-headed mother to my child is because of Medicaid expansion. Drug court is completely... Drug court is completely insurance-based, and if I did not have the Medicaid expansion program, I would not be able to be enrolled in drug court and would more than likely be in jail once again. I stand before all of you today as an advocate for the 5-point agenda and for Medicaid expansion because I am living proof that by giving individuals suffering with substance use disorder access to health insurance, we, as a society, are giving people like me the chance to be who we really are again. I am proud to support the 5 points for New Hampshire's future because I understand that signing my name on this endorsement card means making the decision to take a stand to help others, like me, turn the tide on addiction. Thank you.
It's really Ashley, who is one of the many, many heroes who are shining a light on this disease and really the promise of recovery. So thank you, Ashley. Next, Tracy Fowler, who's a prevention professional, will speak to the importance of investing in statewide prevention programs.
Thank you, Linda. Good morning. My name is Tracy Fowler, and I've been working in prevention for nearly 20 years. I also serve as the chair of the Prevention Task Force for the Governor's Commission on Prevention, Treatment, and Recovery. When looking at youth substance misuse in New Hampshire, we have to keep aware of 2 realities. The first most promising reality is that our statewide and local community-based prevention efforts are working. Overall, substance misuse among youth is on the decline. High schools across New Hampshire participate in something called the Youth Risk Behavior Survey every 2 years. This survey is administered by the Centers for Disease Control and Prevention, and it measures attitudes and behaviors associated with substance misuse, mental health, and other key risk behaviors. The results, released in February of 2015, show the numbers going in the right direction for prescription drug misuse and alcohol and marijuana use. However, the second most critical reality is that despite our steady decline, statewide declines in youth misuse, New Hampshire has consistently ranked in the top 5 in the country for youth drug misuse and binge drinking. According to the 2014 National Survey on Drug Use and Health, New Hampshire has some of the highest substance misuse by youth and young adults in our country. So while progress is being made, we cannot lose sight of the prevention work that still needs to be done. The fact is, a teenage brain and an adult brain are 2 very different things. A teenage brain is not yet fully developed, and teenagers get addicted to every substance faster than adults, and once addicted, have a much greater difficulty ridding themselves of the habit. Now is the time to double down on our prevention efforts for our youth and young adults through expanded support of our 13 regional public health networks, community-based coalitions who are actively working with multiple stakeholders within their communities to increase evidence-informed practices, programs, and policies that will curb youth misuse. In addition to supporting and expanding our existing prevention efforts focused on youth and young adults, we recognize that we cannot wait until adolescence to begin this important work. According to the National Institute on Drug Abuse, by adolescence, factors that may influence the tendency to try or become addicted to drugs, such as children's attitudes, behaviors, family interactions, and relationships, are well established and not easily changed. The evidence is clear that when there is an increased focus in the areas of early childhood, like adequate nutrition, a stable home environment, physical and cognitive stimulation, and good classroom management, starting from the prenatal stage and going through age 8, healthy behaviors begin earlier and substance misuse risk is reduced. Prevention is and must be a field that is driven by data. New Hampshire must adopt and build on existing evidence-informed prevention practices, programs, and policies that cover the lifespan of a child's development. I'm happy to stand here today with New Future's advocates, local and statewide officials, prevention professionals, and concerned citizens to endorse 5 points for New Hampshire's future. Thank you.
And now I'd like to introduce Sandy Coyle, who's the Executive Director of Granite Pathways, and she will speak to the importance of behavioral health workforce development and removing barriers to insurance coverage for substance use disorders.
Hi, my name's Sandy Coyle. First and foremost, I'm a woman in long-term recovery, and what that means for me is I haven't used a drink or a drug in over 12 years. And the recovery that's been available to me is available to all of the people that are suffering and struggling with substance use disorders. By being active in my recovery over the last 12 years, I've been able to live a life second to none. My son is 11 years old and he only knows me as a sober mom. I have a fellowship of community members and have been able to be a statewide advocate on behalf of this issue and making sure other people have access to services that can help them maintain recovery. I'm the Executive Director of Granite Pathways, which has launched its recent program, Safe Harbor Recovery Center in Portsmouth. And our broader mission is to help advance New Hampshire's statewide framework for comprehensive mental health and recovery services. I also speak as the chair of the board for the New Hampshire Alcohol and Other Drug Service Providers Association, which has approximately 120 members to date. I want to start by also reiterating our thanks to New Futures, all of our statewide and community leaders, and the policymakers working to address the public health crisis. And I also want to reiterate the call to action, as others have today. There's a lot of work to be done, and this coming legislative session will be critical to our continued work in shaping the framework which serves as New Hampshire's public health system and meets the well-being of our people. One hurdle we have to climb is advancing behavioral health workforce development. Our state's done a lot to accomplish increase in substance use treatment, increase in funding for the work that we're doing, but we need professionals to be able to provide those services. Currently, New Hampshire's system, there are many barriers and a lack of incentives for professionals to become licensed practitioners or for practitioners to cross state boundaries and work in New Hampshire. Additionally, insurance companies need to be held accountable for adequate reimbursements and parity enforcement. Lastly, legislators and state leaders need to ensure we remove barriers to insurance coverage by supporting efforts to ensure health insurance carriers are compliant with federal law. Supporting coverage for recovery support services and private carrier benefit arrays. and supporting efforts to eliminate barriers to non-opioid alternative medications with tiered formularies. As a woman in long-term recovery from alcohol and other drugs, I'm proud to stand here with New Futures and all of my fellow advocates supporting the 5-point agenda to turn the tide on New Hampshire's opioid epidemic. The future of our friends and neighbors are worth investing in.
And now I'd like to introduce Eric Adams, who is the Prevention, Enforcement, and Treatment Coordinator at the Laconia Police Department and a New Futures board member. Eric is going to offer a community perspective on this policy agenda.
Good morning, everyone. My name is Eric Adams, and I have been with the Laconia Police Department for 4 years. In my current role as the Prevention, Enforcement, and Treatment Coordinator, I work with individuals who are suffering from substance use disorders and their families every single day. I see the desperation of individuals suffering from addiction and hear the heartache in their voices of family members who just want to get their loved ones some help. I understand how it has impacted our local community. So far in 2016, there has been 57 overdoses within our community in Laconia. This epidemic has put strains on our social service agencies and affected local businesses. I often speak to middle and high school students about the dangers of drugs, and there's no question that there are high school kids in our community who are using heroin. Although progress has been made over the last few years, we have so much more work to do, especially in the area of prevention, so that we can support a new generation of healthy Granite Staters. That is why I stand here today in my role as a local official, community member, concerned citizen, New Futures board member, and most importantly as a father. I am happy to endorse New Futures' 5 points agenda and stand with so many who want to turn the tide against this epidemic.
So for those of you who want to know more detail about the 5 points in our agenda, there is a white paper that is available over on the table right there, and also on our website, new-futures.org. There's a slash part to it, turning the tide. Thanks, Sheila. But definitely, if you go to our website, you'll be able to find it. And before I take questions for myself and our speakers, I just want to thank everybody who's here for your support. It is because of all of you that we are beginning to turn the tide on this epidemic. So thank you so much for all that you do. Really appreciate it. So at this point, I'd like to invite Ashley to come up and be the first person to actually take the pledge to support this agenda.
Turn the tide.
Ashley, let's turn that tide. And everybody should know, there are cards here for you to fill out and submit. Sheila Vargas from New Futures can pass them around. There are some here as well. Here's the box to submit them. We encourage you to do that. Be in touch with us. You will see our advocates in your communities working to get your support for this agenda as well. So thank you very much, everybody. We really appreciate your support.